We will be welcome everybody to a special edition of CPS IMG VMR. Today's session will be another episode of mock interviews. So we started with our very first mock interview session last year, which was very successful and appreciated by a lot of the CPS community. So we decided to do a refresh version for this year. And the aim is to sort of show the process of how interviews are conducted. We may not be in our fancy dress and so on, but we want to establish that it's it should be a relaxed interaction between faculty members and also applicants. So we're going to go through 3 mock interviews. We have 3 guests today. We have Kirtan, we have Franco, and then we have Deborah. I'm going to ask each of them to unmute and maybe tell the audience a little bit about themselves. So they've prepared for these interviews, and they'll each have about 5 or 6 questions. So these are standard questions that you will get on an interview. So I'm going to first ask Deborah to unmute her mic, and then Kirtan and Franco.
Hi, everyone. I'm Deborah. I'm a medical student in Argentina. I'm really happy for being here today. Thank you, Franco, Kirtan, and Ravi. We had to coordinate our schedule. And yeah, I hope we can help everyone that is applying with this episode. Kirtan?
Sure. So good morning, good evening, and good afternoon, my friends. All of you are joining us from different parts of the world. And I firstly, wanted to extend a heartfelt thanks to all of us for joining, because I know that it's a busy time. Some of you might be applying, some of you might be residents, like my friend Franco right here. And it's very busy. Same true for Dr. Singh also. So all of them have, come together to help everyone. So wanted to thank you for joining this session. And we are not expert by any means, but we hope that based on our experience and based on, cumulative efforts, we will try to help every one of you in best way possible, and hope that everyone takes away at least one important point from this session, which can help them through their interview cycle. So thanks for joining. Looking ahead to this session. Franco?
Hi, everyone. I'm Franco. I'm really glad to see everyone here. I really echo what Kirtan said. It is really amazing to be here and to help you, from our experience, to kind of cope this interview season. And I really hope everyone kind of takes a message from this and takes a learning point so they can be successful in their careers.
Okay, very good. I'm going to ask, let's see, Marcella, Yasmin, Amanda, Rafa to monitor the chat. We will ask if you have questions, please put them in the chat and we'll try to answer them after the session. So the format will be, we'll start with Deborah, and after the questions, the answering of questions, then we'll do a little bit of feedback, what went right, what maybe didn't go right, and then we'll do the same thing with Kirtan and Franco. And at the end, we'll give, I'll probably give my top tips for interviewing in the residency program. So Deborah, are you ready to go?
Yeah, let's
okay.
do it.
Well, we'll start with the first question. So welcome, Deborah. First question is, if you could describe yourself in one sentence, what would you say?
My sentence would be, my discipline is my motivation. I listened to this sentence from a triathletic woman, and she said that her discipline for workout every day, it's her motivation, that some days she doesn't want to go work out, that some days she don't do a great workout, but she continue doing every day. And I think that sentence fits well on my life. I think on my studies every day, some days I don't want to study, or I am studying a subject for med school that I don't like at all, like for example, traumatology. Can be like on my personal health too. Sometimes I don't want to go work out. I don't want to, but I continue going for CrossFit, swim, running. And for reaching my goals, my discipline always helped me to get there. So even in difficult times or times that I'm really struggling, my discipline will be with me.
Excellent, excellent. Great to know what motivates you or gets you up out of bed every day. So, what did you enjoy most during your clinical rotations?
I enjoy it a lot to have contact with patients and family. I am an extremely social person. I love to smile, to hug, to explain if they have any doubts about anything, and sometimes know something personal about them, like a food or if they have pets. And during the pandemic, I was with my dad working volunteer in Brazil, and I think that time in Brazil reinforced this, make me like even more to have contact with the patient and the families.
Awesome, awesome. Great to hear that you're very much in tune with patient care. Ultimately, they are the people that we do deal with on a daily basis. How would you describe your strengths?
I think I have focus. I think I could define on that. Doing on med school, I passed for a lot of difficult situations that I moved from my country. I was far away from my family, from my friends, learning a different language, learning Spanish. But even with all that, I continue like looking for what I want to become a doctor. And yeah, and I continue focus even with a lot of things happening that could not help me.
Oh, excellent, excellent. So from this point forward, we will conduct our interview in Spanish. Is that okay?
Yeah.
I'm only joking.
Sí.
So on the flip side, how would you describe your weaknesses?
I will answer that I am too self-critical. I am a person that I am always having big goals. I'm always looking for learn more, study more, to be a good student. And sometimes when I don't get a good score that I want, or something don't go the way that I plan it, I don't appreciate everything that I have done so far. I am like, I don't remember everything good that I did, like that I already study another career, that I know language. I am always looking up here to get here, but I don't appreciate what I did here. So I don't have self-compassion for myself, and I think that can be a weakness sometimes.
Excellent, excellent. Deborah, tell me, if you were a color, what color would you want to be?
I would be blue. It's a color. My mom is a painter. She loves painting, and she always tell me like to look at the sky and say how much colors you can see in the sky. And if everyone looks, there is a lot of types of blue. There is orange, there is white, there is red, and blue was always my favorite. And blue reminds me to the ocean, and that is one of my favorite places to be. And yeah, blue is the answer.
Very nice. Yes, I also enjoy the color blue. And if you didn't pursue medicine, what would you have opted to do instead of medicine? What would you have liked to have done in life instead of medicine?
So if I didn't first medicine, I would first medicine because I already tried to be a lawyer and didn't work. But I didn't see myself as a lawyer. Like that's why I decided to study medicine. But I love, like, one thing that I love about law was when I was doing my thesis in the end of my graduation, doing research, learning a lot. So imagine in a place that I didn't study law, I see myself in a library, study something. I love the smell of old books. I see myself with books. I don't know what it will be. It's difficult for me to answer because I already studied something else, but I know I will be studying something.
Excellent, excellent. And the final question is, what are you most proud of in your life or in your journey through medicine?
I am most proud. The thing I'm most proud of my life is that I leave Brazil. I live a career, my friends, my family, to start a new life in Argentina with a language that I didn't know when I got here. I didn't know Spanish, And I did all that for become a doctor. So it was really difficult. It still is difficult, but I think worth every second of my decision, and that is what I'm most proud of in my life.
Okay, relax now. We concluded this mini interview. So, Deborah, these questions are very come up very frequently, and some people in the chat have mentioned that they had some of these questions. So, what I would want to mention to everyone is, like, most of the faculty members that you will meet on the interview trail will be physicians and not trained interviewers. So a lot of times, many of us haven't had a course in being an expert interviewer, except that we are told certain questions that we can't answer that will raise red flags, like anything about if somebody's going to have a pregnancy, get pregnant or married, or what their sexual gender is, or probe into personal things. So those questions are not to be asked during an interview. So a lot of us do tend to look over these common lists of questions and use them. And then it depends on the flow of the interview that we may sort of go off on a tangent and explore, like some of the stories that Deborah mentioned, we may probe further. Like I would have asked, like you initially were a lawyer. Tell me why did you move from law to medicine? What was it about it? So you can control the direction of the interview. So for feedback, first of all, I love the background. Your personality shone through, even though we're doing a virtual interview. You're smiling, I can see energy coming through, you're happy to be here. And this definitely helped in becoming very comfortable with asking you questions. So the first question is a routine elevator pitch. If you could describe yourself in one sentence, what would you say? And you had a very good answer. So what I really liked about your answers were they weren't too long and they weren't too short. So I've been in situations where I had somebody keep talking for 5 minutes, and then I'm like, I don't have any time to really ask you more questions. So you end up shooting yourself in the foot if you spend too much time answering one question, because we have a certain amount of time to get to know you and see if you could be a good fit in the program. So very, very appropriately timed questions. First of all, you do need to prepare. The one thing you don't want to do is come across being too well prepared or rehearsed. There's even been people we know looking to sides and reading off, I don't know what's on the wall, but okay, preparing all the common questions and reading off a blackboard or a whiteboard or post-it notes or things like that. So you don't want to be too obvious that you really prepared. So you want to have a little bit of spontaneity, but have a framework for how am I going to tackle this question, and just being comfortable. So why become familiar with these questions? That you can be comfortable, relaxed, and you can answer them appropriately. Also, if you are asked a question and you're not prepared for it, pause for a little bit, think before you start talking. What happens a lot of times is the first thing that comes out of our mouths may not be the right thing that the interviewer wants to hear. So you have to be careful. You have to think through, can I tell them something that they want to hear and that they will, that's the sort of answer that they want for this question. So it's not a bad idea to pause for a few seconds and then answer the question. So the first one, elevator pitch, yeah, the motivation, I like that. The keywords, motivation, discipline, this is what programs like. So will you be disciplined to get up every day, come to work in the cold of winter if you're moving up north, and work as an intern? Number two, what did you enjoy about the clinical rotation? So I love that you built this sort of story. Try and answer these questions as a story. Oh, I've had all these patients and I've had remarkable interactions. I just care for patients, so on. What you mentioned was very good. And to me, that means you're a candidate that cares. At the end of the day, patients, programs, hospitals, the medical institutions want caring physicians. So everything you told me was like top notch, and that painted you as an ideal candidate. Strengths, there's been a lot of controversy, like why ask this question? I just put it there because you're going to get asked by it. Again, we're not expert interviewers, and a lot of physicians will grab certain questions like, oh, I ran out of questions. I have a brain freeze. Okay, let me ask, what are your strengths? So that will be a question, and it's good to be prepared for. And there's lists out there. You don't have to pay for lists. You just can Google, and there's questions or list of questions that you will certainly be asked. And one of them is, what are your strengths? So yeah, I love that you went to a faraway country. You learned Spanish. You know what that means to me? As an IMG, you're going to come here and you're going to be successful. You've already rose to the challenge somewhere, and that is remarkable. So I can tell you a story of somebody that came, was not prepared, and after the first day in internship, packed up their bags and left the program to go back to the country. So it was not what they anticipated, and it could be a shock, you know, whether it be shock, language shock, cultural shock, and so on. So if you've already gone somewhere and have had to learn a different language and had to learn medicine in a different language, and you've been successful, that speaks volumes about you. This is a very tough question. The next one, what is your weakness? You know, we don't want to say like, oh, I am really bad at studying and so on, because that may be a red flag. You don't want to open yourself up too much. But then again, you also, you know, we are humans. At the end of the day, we do have, you know, weaknesses and certain tendencies. So I don't expect people to really tell me something that could be a problem. But you know what? If you have something that is a weakness, you can tell it. And then first, what is the weakness? And if you've made attempts to correct or an action to try and reverse it. So to me, if somebody's saying, oh, I'm a very poor test taker, well, I'll be like, oh, how are you going to pass the board exam? Well, I've been doing this studying technique. I've been doing group sessions with other students and answering question and answer sessions and so on, or tutoring and so on. And then my next test, my score was really good. So to me, that means you remediated with this maneuver or this intervention, and you've done really well. So being tough on yourself can be, and it's not necessarily something that's very negative or will count against you. So there's no correct answer with this, with what is your weakness, but I think we're just looking for how you're answering that question. The color one, I love to answer this. You know, my interview sessions are usually relaxed, and I want the candidate to be relaxed. So I throw that out there because it changes the tone of the interview. Now, all your interviews shouldn't be an interrogation. They should be at least a fun process, right? You get to know this program. Oh, these people are very nice. And then we get to know you through these questions too. So there's no wrong answer for color. You can say red. That could be misinterpreted as angry, fiery, but it could also be warm, right? I want to be warm. I want to go to a program in South Florida where it's warm, so I like red, you know. And then the last one or last two, if you didn't pursue medicine, what would you have done? So that's also a tough one. You know, I always wanted to be a soccer player when I was small, but I wasn't very good to do it. But you know, you could just share stories, and it adds to the fun as well. And not all the interview needs to be about medicine, but it has to be about you. And then what are you most proud about? And again, your journey that you've had is definitely a great story. So what I read about, or I think a very good way of answering questions, these kind of questions, is to tell a story. So you are a story. You're not just a number of lines that you can just ramble off and tell the interviewer. So stories, kind of think about it in stories, and it takes up some of the time, but it also stands out because at the end of all these interviews, how are we going to remember you? And the stories maybe is what might help us remember how you were doing the interview and if you can be a good fit here. We'll keep a tab on these questions. I think let's go to the second interview then, because I think I spent too much time on feedback. But Kirtan, you ready?
Sure.
Okay, so Kirtan, tell me about yourself.
Sure. So my name is Kirtan Patolia, and I come from the state of Gujarat in the western part of India. And you know, one fun thing about the Gujarat is that we love to consume the sweets. So like we are known as the sweet capital, and sometimes people call Gujaratis as sweet because we consume a lot of sweet, so we are sweet people. We are very sweet in interactions with other people. And apart from that, I would say that one of my big things or passion in life is the clinical reasoning. So I am so lucky to be here, with CPSolvers and join this community. So that has been my passion.
Excellent, excellent. I like the sweet part. It made me smile. Why do you want to be a physician, especially internal medicine physician?
Sure. So when I was in 10th grade, so that is when I started reading books. I started reading various novels. And one of the genres of novel which I loved was the mystery novels and the murder novels. So I would read the Sherlock Holmes, I would read the Agatha Christie novels, I would read the Nancy Drew novels. And one of the things which struck me most was that how exciting and thrilling is the job of finding out the root cause of something. It could be anything. So in mystery novels, it's about finding the root cause of, let's say, a treasure hunt, root cause of a murder mystery or something like that. So same applies to the medicine. We know that in medicine, you deal with lots and lots of problem every day. And sometimes things are so confusing that you need a sound mind and a rational approach to go all the way to the bottom of the things and diagnose a condition. So that was my motivation, the diagnostic aspect of medicine. And that's why I thought that since I love the mystery so much, I think physician should be one of those things which could excite me.
Excellent, excellent answer. What could you bring to a program like ours?
Sure. So I think one of the qualities which I have been fortunate enough to cultivate over the years through the help of my residents and other colleagues in med school is that integrity is something which is very important in the field of medicine. Like day in and day out, we know that it is one of those professions in which people experience the burnout at so high rate that like physicians end up doing suicides and so many other things, especially in the United States. We have seen that. So under such condition, having a sound mind and having that integrity, that what you want to do each and every day, you wake up in the morning, you do your job, you go back to sleep, and every day when you go back, you have that sense of satisfaction that you have done something not only for your own happiness, but also for other people, for community in which you are working. So I guess for that, you require that integrity there. You are always on your path. You are not deviating from your path, from your passion. So I think since I have been fortunate enough to develop that virtue, I can bring that to your program.
Excellent answer, excellent answer. We'll skip to this question. How do I know you will show initiative and you are willing to work hard if you enter our program?
Sure. So one of the things that I would say is that in our med school, in last part of the 5.5-year curriculum, we have something known as the internship. So it is very similar to the intern year, which we have in the United States. So in that internship year, you start getting lots of responsibilities. You have to round on the patients. You have to take care of them. You have to present the case. And at the same time, since you know that you will be going ahead in your career, maybe you will apply for residency. So you will also need to work on various projects. And this is the real life, right? That as a physician, you not only take care of the patients, but you also have to take initiative in various research projects, various case reports, various articles, so that you also contribute to the scientific literature and help the other doctors around the world. So that was the case that I was so busy during last year, but still I thought that, well, this is something that I should do. So I seek the help from my residents. I was like, hey, do you think that this is an interesting case? Maybe we can write this up and add to the knowledge of the community. So we would write that case up, and there were lots of hurdles in that. Sometimes we never had the enough skills to draft a proper case report. But then again, with persistence, we will practice it again and again. We would create numerous drafts of the same case report. We would seek help from our professors, our attendings, and then finally we were successful in publishing 1 or 2 nice case reports. So I think that initially it was hard to take the initiative, but now that I have gone through that phase, I can feel that the inertia to begin something is less now, and I can start taking initiatives even when it's difficult.
Excellent, excellent. And we're going to now dive into some behavioral questions, the dreaded behavioral questions. So tell me about a conflict that you had with colleagues and how you handled it.
Sure. So Wow, this is interesting. It's always hard to find the right answer to such questions. Yeah, but I can say that this happened once. So as I said, that in residency and even in the med school, things are often so busy. So in the last year of med school in internship, like when we attend the emergency, we get to take care of maybe, 50 to 60 patients in a span of, let's say, 8 to 9 hours, because we admit a lot of patients and we have to immediately take care of them, stabilize them, and then send them to the floors or ICU depending on their condition. So once this happened, that one very sick gentleman came to our hospital, and the suspicion was that maybe the patient was having very bad sore throat, and that's why the patient was having very nasty cough, little bit of hemoptysis. And that's why my resident told me that, Kirtan, this is one of the interesting cases from which you should learn. So do the physical examination and then tell me that what's going on with the patient. So I did the physical examination. I took care of 2 other patients in the meanwhile. And after an hour later, my resident comes and asks me that, tell me your findings, Kirtan. So I told that, well, I could find that the tonsil was enlarged, patient had kind of, erythema at the back of the throat, and there was little bit of icterus in the conjunctiva as well. And then I skipped over to the lungs, heart, and everything. And then he told me that, did you check the lymph nodes? And I was like, no, I'm not sure. Maybe I forgot it. And he was like, okay, let's go and do that. And we went there, we checked the lymph nodes, and the whole cervical chain, the posterior occipital chain, everything was very inflamed. And in the end, he told me that, Kirtan, that in this case, given the acuity of the situation, we don't even need to do the further testing. This is a classic case of EBV induced mononucleosis because of the involvement of the posterior occipital chain, young age, acute presentation. And he told me that you missed it. So this was a humbling experience for me, And initially I was like, well, physical examination doesn't matter that much, So I was like, why my resident is telling me to do the examination? Why can't we just do the test, So there was that sense of conflict in my mind that amidst so busyness, why my resident is telling me to do this? I have to take care of 10 other patients, right? But then that made me realize that how he taught me in a very gentler manner and how he resolved the conflict actually, rather than me taking the step. So that is something which I took from that conversation, that how I should be calm in those situations, how I should, always look up to my seniors and take initiative from them.
Okay, very good. And say you're an intern and you are passing by a room and your student was being shouted at or told off by a patient. How would you respond to a hypothetical situation like this?
Sure. So in fact, this has happened before. So I can tell you that how it went. So firstly, I would immediately tell my student that, hey, you can come outside. We will talk about it later. Then I would go inside the room. I would ask the patient that, sorry, sir, or sorry, ma'am, we apologize for any sort of inconvenience. We will come back later. You relax. So I will, kind of diffuse the situation. First of all, I will make sure patient is calm, patient is stable, and nurses or any other medical staff are not at the immediate risk or danger from the patient's behavior. Once that is done, I will get out of the room, and then I will ask the student that, hey, what was going on? Was there any issue which was there? And once I listen to the student's part, we will take the appropriate actions. But in the meanwhile, I will also tell my student one important thing, that always try to put yourself in someone else's shoes. Just think about it, that if you are a patient in the hospital, and this is how routine works, that we order the morning labs for so many patients, and usually morning labs happen at 4 o'clock. So think about it, that you are a patient, you are in your bed, and somebody comes at 4 o'clock in the morning to prick you, they will prick you at multiple sites. Sometimes not one prick is enough. They will look for other veins. They will draw the blood from you. Then at 6 o'clock, maybe medical student will come to take the history. Then an intern will come. Then after a few moments, attending will come. The team rounds will happen. Sometimes, they are eating food. Sometimes they are changing. Sometimes they are using the washroom and you are interrupting them. So just think about it, that if you are in that situation, isn't it slightly possible that you would lose your calmness just for a moment and maybe you would frown upon at the other person? So it's totally reasonable, right? So I would try to explain my student that try to put yourself in their shoes and just think about it and don't take it personally. It happens, right? Your job is to stabilize the person and go away from it. So that is the advice that I would give to my student.
Very good. Stabilize the situation. I love that. Okay. Switching gears. If you could be an animal, what animal would you want to be?
I am not an animal person at all. So this is very difficult. What would I say? Uh, hmm. Maybe I can be squirrel, because squirrel are very tiny, very cute, very sweet. They just run around here and there. They are very swift, very fast, very sharp. And to be fair, they don't give you many diseases. Like if you have dogs and cats, and if they do something funny, like they bite you or something, you get into ICU straight away. But with squirrel, it's not much. So I think I would go with squirrel.
All right, very good. That's the end of a second interview. So job well done. So very good. Kirtan, yeah, one thing that he did with his answers was he recalled experiences and went back in his journey and used stories, exactly what I was mentioning, to explain his answers. Which you also have to wonder on the other side, how do I keep the attention of the interviewer? They'll have a number of people to interview throughout the day, so you want to make it a memorable one. The other thing is you want to inspire the person as well and have a very active, I guess, voice. Be not very monotonous. Just have the same tone throughout the interview, but also you change up your tone. So again, just by all of you being here, you are preparing. So preparation is key. So this is one step. Other step would be doing what we're doing. So doing these mock interviews, very important, because that way you learn these things. And the third thing, if you can do nowadays, everybody has video on the phone, is interview yourself. If you're not able to do it with somebody, just take these questions and rehearse and record yourself and see, and you will be kind of surprised of what things we tend to do, or the way we use our voice in trying to answer these questions. And sometimes one word of advice, sometimes I sometimes hit a mental block and I just say a lot of ums or things like that. I've had people that do that a lot, and it does become distracting, is to whenever you have this tendency to have a moment trying to think about something, maybe stop before you use some of these or ahs or things like that. While you're thinking, stop and then start speaking again. And this is a good technique to try and at least prevent that, because that can be distracting to the interview as well. So sometimes I have a mental block and I'll go and it can just sort of ruin the flow of it. But this is a technique somebody taught me, and I was like, oh, this is great. So I use it with any student that is presenting and is pausing a lot of times and using ums and ahs and so on, and I'll go through it. And at the end of the day, they tend to present a lot better. Okay, starting with the first question, where are you from? And used this sweets from Gujarat. So again, you used your background, which was very good. You can answer this question any way you'd like, and it's a very general question. So this is your elevator pitch. So do prepare for it, but then also don't show that you have prepared too much as well. And like Kirtan had shown, be very active and change the pitch of your voice as well. Don't make it too monotonous. So he is a perfect example of doing that. He loves to tell stories. Why do you want to be a physician? So I love not like, oh, I love medicine, I love pathophysiology, I love the Robbins pathology textbook or Ganning physiology textbook, and saying, no, I love murder mysteries. It's a mystery, Sherlock Holmes. And that got me very excited as well. Like, oh, that is exactly why I also enjoy medicine, and that's why we come to CPS. And the third question, what can you add to this program? So things that would make you an ideal intern: being compassionate, being a good team player, having integrity, being reliable, being honest. These sort of things, these traits are very good to hear about. You picked integrity, and that was a very good trait to discuss and elaborate on, and how it has helped you in your experience as well. So that was a good choice there. And the fourth question, How do I know you can show initiative and are willing to work? So you went through all the different difficulties and with write-ups, and you try to get help in trying to write up cases and find cases and things. So it showed you a busy, like a squirrel behind the scenes trying to do something. So trying to do some work in spite of not having the facilities maybe to do that. You could have walked out of med school with 20 publications, but you tried to get these cases or try to write them up. So even though you didn't write them up, you may have tried to do this, which to me means you're quite a busybody behind the scenes. So that's very good. The conflict one is very good. How would you manage conflicts? Now, you had a disagreement with maybe the workup or something like that there, but conflicts could also be you could be in a situation where somebody was incredibly mean to you, and how did you diffuse the situation? So there's a great method to trying to tackle this. If you're going to explain it, usually first, number one, explain the situation. Number two, what did you do to resolve it? Number three, what was the outcome? So I could say, oh, I was I was in a emergency situation with a patient, and the nurse came and asked me that I'm not doing the appropriate workup of the patient maybe, and that I shouldn't be in the room participating in the care of the patient. My intervention was, oh, I'm a member of so-and-so team, and I am here to help with stabilizing the patient. This is my patient I follow daily. And the result was then the nurse was like, okay, you are part of the team, so you can participate in the care of this patient. So that's just simplifying it. So have something prepared. Here's a key. You may be asked the same question by two faculty members. So usually you may be interviewed. There's a number of ways of being interviewed. You could have one-on-one with 2-3 different people. You could have one interview and then one team, like a group interview. So you could be asked the same question twice. Here's what you should do. Prepare maybe 2 different answers to these questions. And that way, when after this interview, usually people sort of sit in a circle and they discuss each applicant. And it's always good where I hear, oh, somebody answer this question using this scenario. Oh yeah, they told me about maybe this scenario, which is different. So it's great that you have a diversity in your answers and not the same answer for everything. Same thing that goes with cases. I love to ask about cases, and always prepare at least 2 cases, because the same thing may happen. Interviewer A may ask one case. Tell me about an interesting case that you had in your 3rd year, 4th year, 5th year, and so on. And then interviewer B may ask the same thing. If you answer with 2 different cases, again, at the end of the day, the interviewers may sit around in a circle and say, oh, Kirtan told me about a case of meningitis. And they're like, oh, Kirtan told me also another case of maybe shingles or something like that, So that just shows, oh, great. They're 2 different stories rather than, oh, the same case that was rehearsed and prepared. You have many different cases that you can recall in. So if you could be an animal, it was interesting. You were able to answer all these difficult questions, and then when it came to a simple question, just take a pause. But the one thing I want to say is like, oh, Kirtan was stumped by a animal simple question. So yeah, I wouldn't say, oh, this is a really difficult question, I don't know how to answer this. Like, just pause and then think about it. And the first animal you could reach for, and you're in Chicago, so if you look in your backyard, you will see squirrels. So I'm sure. Do you have squirrels in your backyard there or outside your window?
Yeah. So when I walk to the hospital, I see squirrels and rabbits sometimes.
So there you go. So a squirrel is not, any animal. It's not a bad. I mean, no animals are bad. So you can pick any animal you want. But then it's just it helps us to switch gears. You answered a very stressful 2 or 3 questions, right? Those behavioral questions. So it helps us to switch gears and also help you to be relaxed. None of us want you to be stressed and nervous, and then we don't want to catch you out. We do want you to be relaxed, and you can answer these questions, and that way we can get to know you as well. So, all right, very good. Should we go on? What time is it? 2:14. So yeah, we are taking a lot of time. But Franco, I may shorten your number of questions though, because I think the feedback is very valuable, and I hope it does help our people, everybody that's here, that's participating in the chat today. So, all right, are you ready, Franco?
Yeah.
All right. Franco, welcome. So could you tell me about a mistake that you made in your medical training and how you handled that mistake?
Hi. Well, oof, let me think. Well, I actually don't make two mistakes. So when I was preparing to do the steps, I always focus on my mistakes of your work. And I am like a perfectionist in that spot. So I always tend to kind of hate myself when I did like a 90% of your work. And I know, I need to study for that. And what I do for that is like I study for maybe 18 hours. So I need to achieve perfection. And I always pursue the 100% in your work, otherwise I'm not I will not be a good student or even a good doctor,
Okay, and tell me, what do you do to cope with stress?
I think people sometimes stress me. And because people stress me, I kind of be a loner. So I don't want to hang around too many people because I don't want to deal with other people problems. So for stress, I tend to hide myself in my place and read about cases, and just to be like that, to be away from the stress is my coping mechanism.
What do you like to do in your free time?
Well, again, I think I haven't had many free time in the last couple of years. This whole preparation for the steps, I have only studied a lot. So my free time was only when I maybe cook, but that was like really, really fast. I think as doctors, we are not allowed to have a lot of free time because, we need to prepare to the patients all the time. And if we have free time, we can make mistakes. So I don't think I have like a specific habit to do on my free time.
Very good, Franco. So I'm going to put you in a hypothetical scenario. So you're walking by a room and a staff member is shouting at your patient. How would you react or respond to this situation?
Ooh, well, I will definitely wouldn't go into that room. It's like really, I don't want to get any bad reviews from the patient. So I will definitely don't interfere with that. Because when with internet nowadays, they can see your badge and they can put a lot of bad reviews on you, and that can affect I feel that can affect my further opportunities to get a fellowship or to even get a job. So I don't like to be in that situation. Yeah, I will probably don't, if it is not my problem, I will never go there. I will let it be and continue to do my work.
All right. So now, say you came across a fellow intern and they were very upset, maybe crying. What would you do to alleviate your co-intern's stress and grief?
Well, again, it's like if it is affecting my work or if it is affecting the workflow, I will definitely say to them, hey, you need to stay away for one moment, and literally you're interrupting the patient care. So if you have any problems, you can talk about those problems later with, I don't know, with your friend or someone else. But first is the patient. So we are not allowed to be like that here. And yeah, and again, it's like I think that the patient is first. So if one coworker is like very upset or like being too emotional, that will definitely impact on the patient care. So I will say I will defer the situation and probably talk about it to the leadership about it. It's like we cannot allow to be like emotional during the work. So yeah, they should deal with that.
Okay. One question I skipped over. Have you held any leadership roles?
No, because I think that I am better working by myself and only myself. I feel that leadership works are like feeding physician egos. So I think that that's the only thing why leadership is made of. They cannot be like, they need to be on the spotlight, and I like to only work on the background and just be myself, do my work and go home. That's the way I feel it. I don't feel like I need to feed my ego with that.
Okay, very good. And last question is, if you could be an athlete, what sport would you play?
Ooh, you know, does your world is a sport? Maybe I can be like a professional Jeopardy player or something like that. I don't feel like physical activity is good for. It's like wasting my time doing physical activity is not something that I would like. I would definitely do some intellectual or maybe e-sport, like playing on the computer or something. Maybe if your is an e-sport and I can make a lot of money with that, that would be definitely something that I will be willing to do.
Okay, very good, Franco. So, good job. I know it's very difficult to be the worst interviewee of the day, but we're carrying on the tradition set by Robbie last year. If any of you go back on YouTube, we did this session last year, and Robbie was the last person we interviewed during that session, and he pulled out all the stops with cell phone going on, and people calling, and interruptions, and all the things that you must not do during an interview, things you do not want to be remembered for. So, Franco, I know it was a tough job, but thanks for at least trying to conduct the worst interview possible. So, first question about mistakes. So, you did something that you must not do, which is boasting about yourself, being arrogant, showing that you're a know-it-all. Humility is key here. So, if you believe it or not, I have come across this before. I've heard of this before. So you try to at least remain humble, and that way you don't come across being, I guess, signaled as being arrogant and boasting and so on, or trying to make yourself look good at the expense of other people. Leadership roles, trying to run away from roles is not also a sign of a good applicant or a good interviewee. So also this stress question, people stress me. So that also is not very good. We work in a remarkably stressful environment. And the key here is being a team player. And you aptly showed that you are not a team player and you do not get along with people. So this is not the way you answer this question. You want to be a pro team player. So we work in many teams in a residency program, and we have everyone as full members, full participants, whether it be the student, it be the intern, it be the resident. Everybody is on equal footing and is an equally important member of the team. And everybody in the hospital, actually, I always implore people, when you do start in a program, get to know everybody, from environmental services, people that clean the rooms, to people that bring the food. Everybody has a very important role, to the nurses and so on, because they all serve our patients, and collectively we all work towards the welfare and benefit of our patients. No free time, you mentioned. So this is a great question. I love this question. I love asking, what do you like to do? So I mean, it's okay. Somebody asked on Twitter, like, is it okay I mention computer games? I'm like, fine. I have a PC back here. I have games on it, and it could be a way to relax. We want to see what you do to diffuse after a long, stressful day. What do you do to unwind? So it's very important. You could go for a run. You could read a book. You can watch Netflix. It's okay. Sometimes people say, "Oh, I watch Netflix." I'm like, "Oh, what do you watch? Did you watch season 4 or season of Stranger Things? How was that?" You just kind of strike up a conversation, and you could have a great time with the interviewer. So definitely have some things ready to mention for your free time. I've had people tell me about paintings. I actually had one interviewer or interviewee have in their background a painting that they had done. So we talked about the painting and so on. There was one interview where a person had a guitar in the back, or somebody had a trumpet or something. They want to show that this is something that they do. And then the interviewer said, can you take that guitar off the wall and play me a tune? And they couldn't do that. So one big thing is, do not lie, because people can catch you out, and you can be put in a very uncomfortable situation. Same thing with your CV. Get to know your CV is very important. So you'll be asked questions on your CV. And these behavioral questions like shouting at a patient and so on. So you elected not to do anything to go in, and your co-intern having a stressful time. So definitely be a team player, be empathetic, be concerned, be nice, have a good attitude towards all your team members, students, and everybody that participates in the welfare and caring of your patients. So that concludes the interviews. Any questions? Anything come up? I have to scan the chat. There were a lot of actually questions, but I wanted to get through. We have some minutes. We can actually go.
Yeah. So Dr. Singh, I tried to answer as many questions as possible, like little bit. So it's all right.
Okay, great. So just for people's knowledge, last year we did mocks, and we did Kirtan, we did Franco. So we did mocks, and I think it was very helpful, right, for you, and it prepared you for interviews. You were very relaxed, and you were able to at least understand how to answer these questions. And a lot of these things I kind of mentioned, I did mention to them. I think they interviewed really, really well. This Siriram actually talked about this. Scoring is indeed a major chunk. So interestingly, there is this framework or this outline for scoring, but it's not set in stone. So I've had people who are like, I really like this person, and I'll give them sort of like, this is my top selection for the day, just because I had somebody that we talked about basketball, and they worked with some basketball team, and I was like, oh, this is great, and they're from an area I know, and the whole conversation was about sports, and through that I was able to glean what the person did to help with this team and sports and injured people and so on. And that I just fondly remember that interview. And when it came time to rank, I was like, I love this person. This person will be a great fit in the program. So it's not hard and fast. Every program has this scoring. So they give you scoring for, could be for the interaction, for behavioral questions, for US clinical experience, and so on. But at the end of the day, they may prioritize one applicant because of a great interview that they did. Any other question? Did that answer your question, Cyril?
Yeah, I did. Thank you, Dr. Singh.
Okay. Any other? Oh, Rafa, every Stranger Thing episode in season 4 felt like a movie. Yeah, it's funny. During intern orientation, I didn't mention about it. So do definitely watch it to if there are any sci-fi fans. All right, how to answer questions. Why are there gaps in CV? So gaps, yeah, be able to answer. You will, if there are any discrepancies or deficiencies in your CV, they will know. There's a way the interviewers know to glance over a CV and look for the way the CV is presented or material entered in research and so on, and they can catch out if there's abstracts that aren't published and you put it in that is published and so on. They will ask you about that. So if there's deficiencies, gaps in education, be prepared to answer that. So you don't want to be caught out on the day and be uncomfortable and not be prepared to answer that question. See, once you get an interview, you pretty much have your foot in the door. Then it's all about make it or break it. If you do a really good interview, you may be considered in the rank order list, like high up. So pretty much I can tell you with a lot of programs, their rank order list will depend on all the stuff that you have plus the interview. So the interview could move you up in the rank order list or move you down in the rank order list. So definitely give a very good interview if you can possibly. How much does the interview count for being ranked? Yep. I guess this question that just popped up. Yeah, very much. For me, it's very much because we've had people rank with lower scores and they gave a great interview, or people with higher scores and they gave a not a terribly good interview, and their rank order is then much less than what their scores and so on would have put them up higher initially. So yeah, I definitely implore people to prepare and anticipate some of these questions. And there's a lot more questions. Some people said like, oh, I know what you're going to ask when I interview with you. I'm like, oh, don't worry. We have a large selection of questions. They can be changed around. So, but a lot of these are the standard questions. I'm just going to share screen. Was there anything else? Rafa, Franco, Kirtan, Deborah, Marcella, anybody want to mention?
Sure. Dr. Singh, I just wanted to mention one quick thing, like just what Dr. Singh said earlier, that you know it's a stressful period, but just try to enjoy it. In fact, that's what Dr. Singh and our Rabi, Reza, all the team members told me previous time when I was in your position, that 2 years from now, you would count these 3 or 4 months as one of the most memorable experiences. So don't go in the interview thinking that I need to impress this person and I need to get into program. Don't be desperate. That's one thing which Dr. Singh told me initially, that don't try to be desperate, just do it like a routine thing. You are enjoying conversation with someone, it's like meeting new people, meeting new friends. So just try to be yourself, be honest, be true to yourself. And I am sure that almost every time it will work and they will like you for being you, not being desperate. So that is one thing that I just wanted to echo.
I remember that, Kirtan. You're absolutely right. We need people. We need you as much as you need us. So it works both ways. And a lot of you are remarkable individuals and have different journeys. So definitely highlight that. Everybody has a different journey into medicine in life and so on, and tell your story. And I think it definitely will make a dent in the interviewers that you meet during that day. I'm just going to put up a little slide thing here. Just
Ravi,
yep, go ahead.
We have one more question. I think it's Lydia. Do you want to say out loud your question?
Thank you, Deborah. So when you asked Franco the question about a mistake that he had done, I thought about it. I'm like, I think I could also struggle through that response, not because I haven't made any mistakes during the time, but because how would you approach that kind of answer to give so that the interviewer doesn't take it the wrong way, though you don't like shoot yourself in the foot. There are times we've all made mistakes here that have costed many people certain things, but you don't want to bring out a very grave mistake that you have done, or you want to come out like you understand what your mistake was and what you did to try to learn from it. So I still am struggling with how to approach such a question.
Lydia, that's a very good question. I can tell you this, just like Franco's first question and answer, that he doesn't make mistakes. I can tell you that I've made mistakes. Everybody, we're human after all, and we aren't all masters of medicine, but we practice medicine. And that's why I see you, Lydia, here on CPS. I see Kirtan, Franco, Rafa, everybody that comes on CPS. We come to learn, to expand our knowledge, and to become better practitioners of medicine. So there's a lot of things I've not seen, and I come here to learn and be prepared for, anticipate for in patients that definitely we see on a daily basis. So if you highlight that there was a mistake and what did you learn from it, I think that's just as important than saying like, I mean, that tells a lot about yourself, that if there is a mistake, you learn from it, and then you have remedied or made changes in your practice, and now you are looking out for that scenario, and you now know what to do. So say, for instance, I had a patient that I was called to see for altered mental status, and I went through like maybe if the patient took some medication, or patient is hypercarbic or has chemically induced maybe some altered mental status due to like hyperammonemia or something like that. And I forgot 5 minutes, 10 minutes in, I should have checked a blood glucose level. And the nurse asked, like, oh, do you want to check a blood glucose level? And I'm like, yes, okay, yeah, sure. And then the glucose was 30. And that was the reason why this patient was altered. So now I've trained myself to make sure when I enter a room and for a patient, or I've called for a patient with altered mental status, one of the first things I check for is the blood sugar low, is the patient taking any medications that could alter their mental status, namely opioids, and also make sure that the patient is not in a declining status where like airway is compromised and so on. So that to me would be somebody that learned something, and that's how you learn. So a mistake like that doesn't mean you're deficient or you're somebody that's potentially is delinquent. It just means you're learning, and that's how it is. You learn from these sort of situations. Ultimately, at the end of the day, the patient didn't suffer harm, but you've learned something, moved on, and you've integrated it into your practice. Does that make sense?
Yes, thank you so much.
All right, great. So just to wrap up, a couple of things I kind of dotted off on this slide. So again, why are we here today? We're preparing, right? So we all prepared together. We kind of showed you some scenarios so you know what to expect. Number 2, know your CV. Definitely you will be asked questions. I love it. Somebody asked about if there's gaps, any deficiencies, be prepared to answer that. Starting off your elevator pitch is your time to shine. You can control the discussion. What do you want them to know about you? When I mentioned preparation, yes, you're going to have some pre-packaged answers, but have an outline and then you can fill it in. So that way it doesn't come across too obvious that you have rehearsed everything. And don't be the person with Post-it notes in the back and you look off to the side and you read off your answers, because that's happened before. We showed you we went through a few behavioral questions. So definitely anticipate what the person interviewing wants to know about you, or the appropriate interaction, like a fellow member that's having a tough time, how would you help them, and so on. Relax, take your time. Sometimes as his people, we tend to just start, we're pressured to start speaking. And sometimes the first thing, it happens with me, the first thing that comes out of my mouth is not the right thing. So just take a few seconds, take a deep breath, and then start answering the questions. Research about the program. If you show interest in the interviewer, the program that also alerts the people that are interviewing you that you are serious about the program, that you're not just desperately just trying to do as many interviews and try and fit in somewhere. So definitely spend a few minutes before an interview and research every program. Ultimately, if you feel like you're not great at interviewing, trust me, a lot of you know more than you think you know. Same thing comes to just daily practice as well. Like I'll get stressed out. Oh my gosh, I have to talk about, I have a patient with multiple myeloma. Okay, what do I remember? Trust me, we all know. And when we put in the situation, I think a lot of us can operate under stress. So definitely you do know more than you think. Be yourself. And a lot of times people say, oh, just relax and be yourself. Yes, you have to take this seriously. Don't be too laid back. I've had people that are like, sit back in their chair and they'll be like, oh, okay, I'm here. I don't have to take this seriously because my CV is stellar. But, definitely be kind, caring, knowledgeable, humble, and so on. Tell stories, like Kirtan exemplified that, and be prepared for curveballs. I don't tend to like these questions, but sometimes they can throw in some curveballs that could put you in a spot. And again, the way to answer these questions, just stop for a second, think, and then think about what could be an appropriate answer for that question. And you can all go on Google and just sort of Google in curveball questions for medical residency interviews. They're all there. So don't fall into these traps. There's people that sell you a sheet of questions and so on. These questions are all out there on the internet, so you can find them. All right, I'll stop sharing screen. Any final words or questions?
No, I just want to say that on the YouTube, we have a lot of videos that Rafa organized a really good time for teats and everything. And we have been doing interviews with IMG doctors. So we always ask them what your advice for an interview, and they have giving answers about that. So yeah, and I want to say thank you, and I really appreciate this time here, and I hope we can help you all.
All right, incredible. Yeah, thank you, Deborah, Franco, Kirtan, for volunteering to be interviewees and being a good sport and playing along with today's sessions. And we couldn't have done this without you. And I just want to wish everybody the best of luck. And you're all remarkable individuals, and you all have your own story. You all have your journey, and try and highlight that. And I definitely appreciate each and everybody's story. So definitely do share that with the interviewers that you come across along the trail. So take care, everybody. Have a great day. Thank you. Bye.